So we're winding down. Last week, Brad, just for you, what did we talk about?
Neurobiology of aggression in children.
Yeah, but we talked about humans, right?
Oh, yeah.
Yeah, we're going to talk about humans again, like 2 weeks in a row, right? I mean, nobody was anticipating that. I considered flipping back to crayfish for a week, just for fun, but we're going to stay with humans. Okay, so hang in there. And what we want to talk about today is sort of very long word here, psychopharmacology of aggression. And really what we're going to talk about are drugs and the effects that some drugs have on your aggressive behavior. Okay? And yes, for those of you interested, even though I'm giving you the treat of talking about humans, still going to talk about serotonin. Because, just in case you didn't know, Lily, serotonin has an impact on your aggressive behavior. All right, so do drugs make you more aggressive? And the correct answer is, of course they do, except for those times when they don't, right? So that's kind of going to be a recurring theme here, Bree. And not only do we need to think about different types of drugs, right? So there are all kinds of drugs. And these drugs have all kinds of effects. So most of you, maybe not all of you, but a number of you probably think about drugs. And in particular, you want to think about what we call illicit drugs, illegal drugs, although that's a kind of shifting sort of concept. Have you guys ever looked at drug schedules, by the way? Do you understand drug scheduling? If you don't, it's perfectly fine because the folks who made the schedule don't understand it. Listen to this, Abigail. This is a fun one. So there are 5 schedules of drugs, right? Schedule 1 being the worst. And so things in Schedule 1, like heroin, that goes in Schedule 1. That's a pretty nasty drug, right? And so it makes sense. We're going to put that in Schedule 1. There's really no reason you should be using heroin, right? Like there's not a benefit to using heroin, okay? And we've not yet figured out a benefit to that. And then you kind of gradually go down, right, to the less addictive drugs, less powerful drugs, drugs that might actually have some benefit, right? What's really interesting about this is, so like a Schedule 3 drug, for example, is ketamine. Okay. No, you know what, right? So it's a Schedule 3 drug. Ketamine is a date rape drug. Ketamine is a dissociative anesthetic that people put in your drink to make you go places you don't want to go, not remember what they did to you, and then like dump you in the side of the road somewhere, right? It's also great if you need to anesthetize your horse, Katie. So I think the reason it's not in a different class is because veterinarians need access to it. Guess what a Schedule 2 drug is? Ritalin. Schedule 2 drug is Ritalin. Now how many of you, don't have to raise your hand, know someone who has been on Ritalin? Like everyone should raise your hand because you were all in elementary school, right? Because, Jonah, what are the odds that someone in your 3rd grade class was not on Ritalin? Minimal, right? Because someone was definitely on Ritalin in your 3rd grade class. You know this, right? Guess what a Schedule 1 drug is? Marijuana. Does that make any sense? Like, something that we give to kids is a higher schedule than something used for a date rape drug, which is a lower schedule than what is legal in many states, marijuana. This doesn't make any sense. The point of that whole story was, I'm not really certain. The point of it was for you to think about drugs maybe differently, right? And so quite often you think about a drug, Brad, and you just think, well, it's a drug, so it's a bad thing, and it's always going to do the same thing to your brain. But that's not true. Drugs act in different ways. Drugs have effects on different neurotransmitters. They have different sort of side effects, right? And so they're not going to have the same impacts. And I think that's something to keep in mind, right, when we're thinking about this. Cocaine is a much different drug than LSD, right? And that's sort of an important point to think about. All right, so of course drugs make you more aggressive, right? Well, maybe not, because there are many times when they don't. And that's many times when they don't when we're talking about different drugs, right? So some drugs tend to make people more aggressive, and some drugs tend to make you less aggressive. And there are different reasons why, and we need to really kind of pull that out. So for example, how many of you think, here's a drug you've all probably taken, Benadryl. Okay, that's a drug, right, Meredith? Does Benadryl make you more aggressive? Probably not, and the reason it probably doesn't is because it puts you to sleep, right? And so that's another thing we have to think about, right? I mean, are we thinking about, like, what are the other effects, like the indirect effects of that drug, right? Some of them are going to have direct effects on your neurochemistry, and some of them are just going to make you go to sleep. And so obviously if it's got some sedative ability, it's going to decrease, right? And we're going to talk about that in some more detail later. The other big question that we have to ask is, which came first? The drug use or the aggressive behavior? There's a mountain of data out there, okay, Tiffany, that indicates violent offenders are more likely to use drugs. Now, does that mean that using illegal drugs makes you a violent offender? Does that mean being a violent offender? What's the causality here, right? And that's the important question. Anytime you look at a correlational study, all you know is that two things move either in the same direction or they move in opposite directions. We don't really know what that relationship is, and it could be some independent mitigating factor, right? So what's something else that we know about people who are, violent offenders? Well, maybe they're more likely to have had traumatic events in childhood, right? I mean, that seems like a reasonable assumption. There's some data to support that. And folks who are drug users tend to have more traumatic events in childhood, right? So maybe they're both connected to something else. And that's really what sort of the important causal point is. So we have to think about this. Which came first, drug use or aggressive behavior? These are correlated, but does that mean one causes the other, or in what direction, right? And that's a much more difficult question, especially because we are no longer like dealing with hamsters and crayfish, right? Emily, we're dealing with people. And I don't know if you've noticed, but people are complicated. And because people are complicated, it makes it difficult to control their environments, right? All right, so briefly, here are just sort of a few highlights that we want to talk about, just to make a few points. We'll talk in a little bit more detail about these as we go along, right? Alcohol, for example, has a pretty clear positive correlation with aggressive behavior, right? Increase alcohol consumption, at least to a point, right? Once you increase alcohol consumption, so far you're going to pass out or die. So there's always that kind of plateau and drop off you got to think, right, Brad? I mean, that wasn't necessarily meant as a joke, but there are limits to this, right? There's only so much cocaine you can take before your heart explodes. So, only to a certain point, Bree, is cocaine going to make you more aggressive. And then when no one is aggressive once they're dead. So that's something to keep in mind. And alcohol, for the most part, there's that dose-dependent sort of relationship. The more alcohol you take, the more aggressive you are, right? And in fact, probably, according to most estimates, somewhere around 50% of all crimes involve alcohol consumption. Violent crimes, I should say, involve alcohol consumption. So that's a pretty significant proportion, right? I mean, if you're thinking about that. And again, does anybody know what schedule alcohol is? It's not. That's what it is. It's not at all. So that's why those drug schedules are all screwy, right? So there you go. Marijuana has a less clear correlation with aggressive behavior. We'll talk a little bit about this. We're going to talk about it, Brad, so just sit with it a moment, right? Because some of this, so we're going to move down a couple points and then we'll think about something. Okay? So, marijuana use is kind of interesting when it comes to aggressive behavior. We'll talk a little bit about withdrawal effects, okay, as well. Cocaine likely increases aggressive behavior, right? I don't think that's probably a surprise to too many folks. Most stimulants are probably going to increase aggressive behavior. Jessica, the problem with that is it may just be increasing your activity levels in general, right? And the more active you are, the more likely you are to be aggressive. Simply because you're doing more things. Odds are something there's going to be aggressive, right? And there could be some other issues going on as well. Opiates, I don't know if anybody's ever heard of opiates before. Those they may actually increase aggressive behavior. We'll talk about some interesting things there as well. However, once you become dependent, so there was a study with looking at folks who were heroin addicts, right? And so once they became dependent on heroin, their sort of criminal behavior, their antisocial behavior shifted from, instead of trying to inflict harm on people because they were a little extra aggressive, it actually shifted over to ways to gain money, right? And so they spent more of their time trying to gain money than they were sort of in aggressive acts. Not that, like taking money is not aggressive, but there are non-aggressive ways to get money, right?
To gain money to feed their opiate habit?
Yeah. I mean that's at least the assumption with these things. There are a couple other big things to consider here. One of these is comorbidity, right? Have any of you ever worked in a sort of like a place that offers psychological or psychiatric services, right? So how many of those people walked in with only one problem? No. Yeah, none of them, right? None of them walked in with only one problem. Nobody walks in and says, you know what, I think I'm only depressed, and that's it. There's not any anxiety, there's not any agitation, there's nothing else going on, I'm only depressed. It doesn't work that way. Nobody comes in and says, you know what, I'm only using heroin. That's it. I'm just addicted to heroin. I wasn't dealing with any other things before that or since then, right? Nothing else is going on. You can just get me off this heroin, things are going to be fine. We've got comorbidity issues, right? So we always have to think about the other things that are going on. Many individuals who are substance abusers also have other issues going on. They often have, they can be bipolar, depressive. They could have other, personality disorders. They could have a variety of other things going on top of their drug use that's causing them problems, right? That becomes very hard to sort of pull out, right? Is the aggression because of the drug use? Is the aggression because of the other psychiatric issues that they're dealing with at the moment? So that becomes sort of an issue as well. Then, Brad, I think we're going to come back and maybe address your eye rolling. And you have this great way of only rolling like one eye at a time. If you've ever noticed that, like you can independently roll each eye, which is really a talent. Your ability to express derision is unparalleled. So we don't have to answer this. But let's think about this for a moment. How many of your parents view marijuana use in a negative way compared to how many of you think marijuana use is negative, right? And I would imagine that there's a bit of a shift there, right? If you were to ask your grandparents, that's a slightly different cohort that might have a different opinion. But most of your parents probably being Gen Xers, right? Ask them about cocaine, that's a different story. But marijuana, that was sort of like an 80s Wall Street reference. Nobody cared to laugh at that, that's fine. Some of these studies were conducted at a time when social attitudes were different, right? Toward particular drugs and the folks who use those drugs. Marijuana being a major sort of player in that, right? And so sort of the history of marijuana in and of itself has been very controversial in the individuals that use that, the individuals who advocate for it or don't advocate for it, right? And there are all kinds of sort of problems. And we're seeing that play out now in politics, I think, right? And some of these legalization efforts and their success in some places and their resistance in others. And again, if you really start to compare the effects of marijuana on your behavior to alcohol, for example, right? I'm not saying that they're both like great, just do them all the time, right, Bree? That probably doesn't seem like a great idea. But I think if we're going to let folks use alcohol, then probably some substance that doesn't seem to be like carry as many ancillary problems, actually, people should jump to that, right? So maybe we should be more restrictive on stronger, more detrimental substances and kind of relax a little bit on those others, right? Or we could just go like all Schedule 3 things like ketamine are cool. Everybody should do those. Because it's easier on you than Ritalin, right? I mean, just have at it. We'll give Ritalin to an 8-year-old. I think you could probably take ketamine. It's just ridiculous, right? Okay, so questions about this, comorbidity issues. Oh, let's talk a little bit more about this social stuff. Some of these studies, particularly with marijuana, were conducted back in like the 70s, right? Which has slightly different sort of social considerations. Some of these drug studies were also conducted at a time when methods were different to measure certain things, and so you have to consider some of that as well. Questions about that? That's not so bad, right? So, the drugs make you more aggressive. We don't know. We'll figure it out. What we want to know is, one, how would you test human aggression in the lab? Right? Like, how are you going to go about this? We're not going to recreate Thunderdome and just like put two people in a pit and say, fight it out. And you know, whoever wins that gladiator match is clearly the most aggressive. And we're going to measure that by you know, swipes with a battle axe or something, right? I mean, I don't know. We're going to operationally define aggression by battle axe swings. That's not how we're going to do this. That's not getting by the IRB. I tried that one. They told me no. I could not let two people fight with a battle axe. I told them there was going to be all kinds of great data come out of that. And I said we can even get the folks, like, I thought this is going to be great. We'll do multidisciplinary sort of approaches. We'll get the folks at the med school who are studying like emergency medicine, right? ER kind of stuff. You want to be an ER doc, come on over. We're definitely going to have some great stuff for you. Things you're not going to see anywhere else, right? How often do you get a you know, battle axe wound coming into the hospital? I mean, you're going to have some real, you put that on your CV when you go to apply for residency, definitely somebody in like medieval Europe's going to want you for their hospital. It's going to be helpful. I don't know. He didn't go very far. But the first thing we have to do is define aggression. And I know we've done this, and we've done it like a million times in a million different ways, right? But we have to maybe define it differently in humans than we have other species. So there was this guy, Buss, back in the late 60s, and Buss said, responses which result in the actual or ostensible delivery of a noxious, aversive stimulus to another person. That's aggression. That's how we're going to define aggression in the lab when it comes to human aggression. Because it's a noxious, aversive stimulus, then it's something that can inflict harm. It's also something that you would attempt to avoid, right? Okay? So something that you don't attempt to avoid can't really be defined as an aggressive stimulus. Now that context makes a difference there, right? Because sometimes you think, well, I'm going to get right in the middle of this aggressive contest. And you're thinking, well, I'm not avoiding anything then, right, Katie? So think about that. But normally, for example, you would avoid a punch to the face, right? That's something you would normally try to avoid. So that's going to be a noxious or aversive stimulus. There are many different approaches to studying aggression in the lab. There are sort of three major approaches. I love this one. It's called the Buss aggression machine. I just think that's a cool name. We should all make aggression machines, right? I just imagine this like machine that like steam's rolling out of it. It's got to be red because it's aggressive and it's just like charging at you, maybe with some like bullhorns on the front. That's not at all what this is, so don't like write that in your notes. Here's the deal with the Buss aggression machine. You're going to walk into a, to an experiment, and they're going to say, okay, here's what you're going to do. You've been randomly assigned to one of two roles. In fact, you're only going to be assigned to one role, and later they're tricking you here, okay? You are going to be someone who's going to administer a shock to this other person who's trying to learn whatever, it doesn't matter, right? They're trying to learn something, and every time they get a wrong answer, you just get to give them a shock. That sounds like fun, right? Please don't answer that in the affirmative, or I'm going to have to refer you to someone. So, every time that the other person gets a wrong answer, we're going to give you a little shock. You're going to do that to the other person. You get the button. Now, on this device, you are able to select the intensity of the shock and the duration of that shock. Okay? That's what you get to do. So you get to decide how much to shock them and for how long. Okay? Now, in reality, there's not another person over there. Okay? Right? Not another person. You're not really shocking. You don't know that, though. Okay? But you're told you're going to give them a little shock every time they get it wrong. Nothing serious. For this particular model approach, we would measure aggression as the duration and the intensity of the shock that's delivered, right? So if we were comparing, two groups, a control group and a drug group, we would want to see which group delivered higher intensity shocks on average, and which group had a longer duration of the shock that was delivered, right? And we would say that group would be more aggressive. It's pretty straightforward, right? That's a very solid operational definition of aggression. Okay. One of the other major models is Taylor's competitive reaction time task. In this case, you are going to be competing against someone else that you can't see, right? So, okay, we need you to, as quickly as possible, respond. Half the time we're going to make sure you're wrong, like you're the slowest. You don't know this. But like half the time, just randomly, we're going to say, sorry, you were slow. And we're going to shock you, actually. So, see, I know, right? So you're not going to want to, you want to sign up for the other one where you get to shock people and you're like in the clear. This one's a little different, right? Because you will be shocked as well. Okay. Now, what they do is that fake competitor increases the shock intensity over time, right? Slowly sort of creep up the intensity of the shock. Still nothing that's going to cause permanent damage. Okay, we're not really going to try to hurt people, but we do want to give you that aversive stimulus. Right? What you do then is you try to look at the person's response to that increasing intensity, right? And you would imagine if someone is shocking you a little bit more, then you're going to increase your shock intensity back on them as well, right? Because that's kind of this sort of reciprocal retaliation sort of approach, right? And that's normal. Right? That's perfectly normal. Okay. How many of you have ever been in a? Anybody do martial arts? No. Anybody ever been in it's like now you
A long time ago.
Long time ago. Did you ever have a situation where you were fighting someone, and it was supposed to be just like a normal practice fight, right? So you're not really like full force, like right into somebody's face or something, right? But then they like hit you a little harder than they should have, and then what'd you do?
You give it back.
Yeah, you give it back, right? I mean, that's normal, right? That's not, you can admit to that, Brad. We're not going to think you're an aggressive weirdo. I mean, well, not because of that. Maybe
Right.
other things that you've done. Other people can make that judgment if they want. But that's a normal process, right? If someone else increases their aggression, you kind of scale up your aggression accordingly. What we would want to see in this case is how quickly do you increase your aggression? How much more do you increase your aggression, right? How much more do you increase that shock intensity, Jessica, maybe than the other person who's getting you, right? If they go up by like 10% and you go up by 50%, like, bang, then we would say, well, maybe you're just a little bit more aggressive than someone who only went up by 10 or 15% on their end, right? So we can make comparisons that way. On top of this, you can actually make some variations in these tasks. This task in particular, one thing that they do from time to time, depending on the experimental paradigm, is they will have like 10 sort of ranges of shocks, and then that last shock, they have it's like a really old reference no one's going to get, turn it up to 11. Okay, so someone did. There we go, Montana. Thank you so much. That it wasn't lost on everybody. So you can turn it up to 11 in this case, right? And 11 is sort of this shock that would, and they tell you, like this will actually cause some harm. And one thing they will do often at the end, when they get to the end of this sort of paradigm, is they will say, you know, your other competitor, they were actually going to deliver that shock to you that was going to cause damage. They selected that. Had you been wrong, this time that's what they would do. And then they see what shock level do you pick the next time. And, you know, someone who's more aggressive is going to be more likely to pick that same sort of like, right, cause some damage kind of shock. And so what you can do is you can compare folks. So for example, someone who's been, you know, someone who's not had alcohol, they're less likely to select that option than someone who's been given, you know, like a moderate dose of alcohol. The final of these sort of three paradigms, this one's a bit more complicated. Okay, so it takes just a little bit more explanation. The problem with these, the bus aggression machine and that competitive reaction time task, is they don't allow you to take a non-aggressive option. Okay, they only allow you an aggressive. They're forcing you to be aggressive, right? Even if you select that lowest shock value, that's still aggression, right? So we're forcing you into that. In the bus model, the bus aggression machine, that was interesting because that's actually a provocation-free model, right? So we're not provoking you in any way. We're simply saying to you, select a shock, and when the person gets it wrong, we're going to deliver that shock. Now, we're not provoking you in any way. Now, in the competitive reaction time task, Chelsea, we're actually provoking you because we're going to shock you half the time. Half the time, you're getting shocked. Whether you were it doesn't matter if you definitely were the fastest and the slowest, because you're the only competitor really, but you don't know that. Okay? So you're the only person competing. You come in first and last. So that's how that works. Again, neither of those give you that non-aggressive option. They only give you an option to harm another person, right? To deliver that. So we're forcing people into making that aggressive choice. So that's not maybe the most sensitive measure, right? Because if we want to see are you aggressive or not, there's a baseline of that bus aggression model. Every single time you're delivering an aggressive stimulus, right? And you're performing an aggressive act. And so if you are below that baseline measurement, that we're not going to know that, right? So we're going to lose some sensitivity there. So some folks have developed this point subtraction aggression paradigm, right? Abbreviated PSAP. This approach is a little bit different. Okay? What you do here is you still have this sort of aggression approach, right? So you still have aggressive. What was that? Anybody else hear that, or was it just me? Is everyone okay? I mean, it sounded like someone's cyborg arm jammed up. I don't know. As long as nothing falls out of the ceiling, we'll be okay. I know I would scoot away from that area, Sydney, if I were you. It came from over there somewhere. I don't know what it was. At least they fixed the air conditioner, right? No one's sweating today. Everyone still has on their coat. But no one's sweating. So there you go. So in this point subtraction aggression paradigm, you actually take money from another participant, a fake participant. That's also taking money from you, right? And so instead of shocking each other, you take some money. You earn money, right, by doing a task. When that other person beats you at that task, they can take money from you. You have the option to take money from them. But you also have sort of two other options. One of those options is you could not take the money. Okay, so you don't have to take money from the other person, right? You don't have to do that. And you also have an option to sort of protect the money that you've earned. So you can earn money, you can protect that money, or you can take money from someone else, right? So you have those sort of three options. Now that's much more sensitive, right? It's more sensitive than simply you have to shock the other person. Okay? So these three models, these three tasks, if you administer these tasks to individuals who have had been administered a drug or they've used the drug, you might get different results. Okay. One model might indicate that there's no difference. One model might indicate a reduction or an increase in aggression, right? Depending on that sensitivity. Okay. Now, some of them all move in the same direction, right? And we'll talk about those examples. So, let's talk about specific drugs and some issues. Now, how many of you know anything about brains and human behavior? I know some of you should. I should see some hands go up. No one's going to go out on a limb. I'm not going to ask you any questions, but it's complicated. All I want to know, Abigail, is do you think human brains and behavior are complicated? Yeah, that's a fair assumption, right? So we're okay there. Because they're complicated, even the most basic thing that we think we know that's definitely going to be just like an easy answer actually has some fun wrinkles to it, and so we'll think about that, okay? So we can start with alcohol. You guys are all familiar with alcohol on some level, right? Okay. Some drugs require more of an explanation than others, Chelsea, and I just want to make sure everybody's got a baseline understanding here of what alcohol is. There is a dose-dependent increase in aggressive behavior with alcohol administration. And again, that's up until the point you black out and die, or die. They're not necessarily, you don't have to do both. Sometimes you can just do one. Or the other. I mean, sometimes you can just die, and sometimes you can black out. Sometimes you do both. So, there is a dose-dependent increase in aggression. What's interesting about this is it's not really the same for everybody, right? In all of the studies, there exists a small subset of people who, when they're administered alcohol, become really aggressive, right? And then everybody else maybe becomes a little more aggressive, or there's no change in their aggressive behavior at all. But that small subset of people can really sort of shift the average, right? So if you think about this, in this class we have, I don't know, like 30 people. They're not all here today. Actually, we have 22, which is not bad because there are like 8 people who are at the COLA conference. So, and then there are like a few other people not here. So there's slightly more than 30 people in this class. But let's say we have a group today. We have, 20, 25 people in class today. And let's imagine we were to give everyone in this class a moderate dose of alcohol. Okay? On average, the classroom would become more aggressive. Right? Classroom behavior would become more aggressive. Now, 20 of you would not change your behavior at all. Right? 18 to 20 of you are just not going to change your behavior at all. You're going to be the same person. You've had, that moderate dose of alcohol. 5 of you are going to become really aggressive. Okay? And because 5 of you become really aggressive, that's going to shift the overall sort of average of behavior, right? So that small subset of people are going to drive the average up. So even when we think, Jessica, that, alcohol definitely has that dose-dependent relationship with aggression, we've talked about ways that alcohol as an inhibitor, right, as a GABAergic agonist, could, inhibit the inhibitor and increase aggression, right? We kind of talked about that previously, right? We think we know some mechanism about how this works. Even with all of that information, it still is not a clear story, right, about whether or not alcohol increases aggression in everybody. So we're going to have differential responses. And I know that's not like a really satisfying answer, right? I would love to be able to give everybody alcohol and to make everyone more aggressive. Because Chelsea, that's an easy story, right? And that's a straightforward story, and that's a story we can build on. But that's not the case. So I don't know which 5 of you think it would be, but 5 of you are going to become really aggressive if you have a moderate dose of alcohol. Yeah.
So, how much truth is there to the myths of like different alcohols like causing aggression differently,
Yeah.
or is alcohol just alcohol across the board, or like?
So, I don't really know, but here's what I'm going to make the assumption. Alcohol, I think, is alcohol, right? Now, the only thing you might want to consider, and this is one thing that people don't really pay attention to, right? And so what I often do is, I was going to say I often purchase alcohol, but that sounded bad. When I do, I look at this side of mostly it comes in a can, because I try to buy like local beers, right? Which in West Virginia, they don't come in bottles. They all come in cans if you buy them at the store, right? You guys know this? It's kind of an interesting thing. You can't get a bottle West Virginia beer. You can get canned West Virginia beer. So, but I'm not sure why. There's some.
So you can shop around.
Is that really why? I don't know. I don't think I'm going to do that because I pay a fair amount of money for the
IPA.
beer I buy, right? So I think that runs counter to the point. But you can look on the side and it will tell you like alcohol by volume, right? So I'm thinking about some of the beer I have at home now. Some of it is like 5.5%, and some of it is like 11%. So I've got like a couple kinds in my fridge right now. And so if I drink a can of beer, and I'm drinking that 5.5% alcohol, I'd have to drink like 2 of those to get the same amount of alcohol that's in that like 11% beer, right? And so I think what some people don't realize is like drinking a bottle of wine and drinking like a bottle of vodka might be 2 different things, right? Not in terms of the alcohol, because alcohol is alcohol, right, when it's in there, but in terms of how much alcohol is actually in like that container, right? So it's the volume of alcohol, or the percent of alcohol by volume, right? So that's an important thing to look at. I don't think people really do that, do they? No. They just drink, right? And so if you think about like beer's pretty low. I mean, wine's not terribly high. Things when you move into like the like liquor and spirits category, because you get like a little bit of bourbon or something, right? And that's a fairly high percentage of alcohol, right? Or you get how many of you purchase things by proof, right? So there's like whatever proof alcohol, right? And so you divide that in half, right? And it'll tell you the percentage that's alcohol. So there you go, right? So you can do some math. So something that's like, I don't know, what's like a pretty high proof that you guys have seen before? 4,000? No. But some things are quite high, right? And that's actually the amount of alcohol. So that's what's actually probably important. So I don't think that it's the alcohol, Brad, but I think it's like if you were just drinking like Bud Light, I think it would take you longer to become inebriated than it would if you were drinking, vodka.
But I'm just like curious about people that are like, I can drink vodka, but like tequila makes me mean. Well, like
I think people are mostly.
You know what I mean? Is that just like a false
brown
perception? Like,
Dark liquor makes them mean.
right? Like, is that just a fake thing that people fall into, or?
I'm gonna assume so. I don't really know. We could test it. I mean, you could try to give. 'Cause I'm thinking like, what is it that would make it? It's.
Maybe like the place, because a lot of times like your normal
Yeah.
beer that you have that like at home, but like you go out to a bar, you want to have something like fancy or whatever. I don't know.
Novel situation.
Yeah.
Yeah, I think it's more context based. I don't think it's actually the alcohol. I think it's something else, and I don't even think it's something else necessarily in the beverage itself, right? Because there's not just alcohol in there, there are other things, right? But I don't think the other things affect your behavior, right? I mean, what else is in vodka besides alcohol? It's like potatoes.
Yeah.
You can mash up and liquefy potatoes. It's not going to do anything to you. If you've ever had your wisdom teeth out, you've probably eaten liquefied potatoes. don't know. That's my thinking. I think Emily, you're onto something there. I think it's context based. Now I'm trying to think like should I like put food coloring in because you know that trick people, right? Right? I don't know. Brad, why don't you do this? Carry some food coloring with you the next time you go out with someone who's drinking, and like squirt a little in there and just see what happens.
Do you think there's any differences in behavior from alcohol across ethnic groups? Like, do you think there's any truth to the whole fighting Irish thing?
I don't think so. I mean,
Like in Mulder's class, we were talking about like the Native Americans like don't have like the enzymes that
that's
break down
I mean,
alcohol.
that was where I was going.
I'd be good though, because I got my 23andMe back and I'm like 100% Irish. So
Yeah, I think
be the test group.
I hate to like ethnic groups because the word ethnic groups carries some connotation I'd like to avoid. But what I could say is based on your genetic, you know, makeup. Yeah, I think some folks are going to be better at processing certain drugs than others. You're right about enzymes, right? And that is a real problem with Native American populations, and the disproportionate rate of alcoholism in those populations compared to something else, other populations. So there are going to be groups, and then this is, so if you want to take it out of something that's, you know, like alcohol, people kind of get like, oh, you know, really touchy about that, right? I mean, but let's talk about like milk. How many of you love milk? Yeah, like the problem is, like a lot of folks are lactose intolerant, and a lot of that's based on your sort of genetic heritage, right? And so there aren't like a whole lot of places where you can originate and actually be able to process milk properly as an adult, right? So that's, I think it's the same idea, right? If there are enzymes that break down milk better in some some populations that have been sort of more isolated in their breeding are better at digesting milk, then there makes sense you're going to be folks who are better at breaking down alcohol, right? I don't think that's, I think it becomes controversial and inappropriate when you start to, you know, sort of take that and you've probably discussed it more in detail, I'm sure, that class with Dr. Mulder. Was that the cross-cultural? Mm-hmm. Yeah. You know, when you start to apply sort of judgment to those groups, that becomes a problem. But yeah, I think that's not surprising. I think about groups like the Amish, right? Like I wonder if the Amish have any alcohol dehydrogenase. Maybe they do. I don't know. I don't know about what Amish beer is. That a thing? I don't think it is.
Amish wine is.
Amish wine is, yeah.
Yeah.
I guess you're right about that. Well, maybe they're okay. But yeah, so I think that's actually kind of interesting. I don't know about how that's related to aggressive behavior, though. That would be kind of interesting. I don't know if anybody's looked at like, right, because again, there are these like small subsets of people when they ingest alcohol become very aggressive. And it doesn't happen to everybody. And it does kind of beg the question, is this a genetic issue? And if it is a genetic issue, then well, that could be interesting.
Well, aren't there, like, when it comes to like those who are alcoholics in the family, like, isn't that also hereditary?
Yeah, no, that's absolutely true. I mean, there seems to be some genetic influence on alcoholism. You guys gonna do that study?
Be fun.
It would be fun. Yeah, it would be fun. I think it would be hard to design and do that program. There's this great book out there you should read called Troublesome Inheritance.
You let me borrow it.
Yeah. Did you read
I
it?
started it in a few chapters.
Oh, I don't have it anymore. It's nice to know where it is, but I've been wondering where that book is. It's been missing from my shelf. It's actually this really interesting book about race and ethnicity and genes, and sort of he argues for this in this whole book. First, he spends a whole lot of time at the beginning talking about like eugenics and how that's bad. So just as a like heads up in case you didn't know. And he gives like some real classic examples, like Hitler. Like, hey, that was not cool. So let's not do that. So just to get that out of the way. But then he goes into this whole idea, it was actually kind of interesting, about how we probably should study genetic differences in people because there's probably some value in that. And like ignoring it and moving on and saying that people who are from different places don't have different different genes, it probably is stupid. And that's kind of interesting. So, I recommend it. Doesn't answer everything, but it answers some things. And then he comes up with some real speculative ideas at the end, which are kind of interesting. Probably not appropriate for this class, but they are appropriate for some conversation. Any other questions about that? That was a real side conversation I didn't mean to have, but it's fascinating. He talks about like cognitive enhancement of individuals of Jewish heritage, which is kind of fascinating. He talks about some other things as well in that. And he cites some evidence. I mean, he talks about the percentage of Nobel Prize winners who are Jewish compared to those who aren't Jewish, right? And compared to like the number of people who are actually Jewish on the whole planet, right? It's a disproportionate number of them have won Nobel Prizes. So, kind of interesting. So there you go. He goes into some studies, I'll call it artificial selection, about how certain groups have actually forced other groups of people, other ethnicities, to sort of adapt into particular directions based on occupations that were available or not available to them, and their likelihood of survival, which is kind of fascinating. I don't know, nobody else thought that was interesting. I did, I found it highly interesting. So there you go. So you did your 23andMe, Brad, and
Yeah, I'm 100% fighting Irish.
well, way to go, I guess, right? I did one of those recently as well. So there you go. All right, who wants to talk about marijuana? Nobody? Everybody? Yeah. It actually seems like marijuana's got sort of this like interesting kind of thing, right? Like low doses of marijuana might actually reduce aggression. That's not too surprising, right? I mean, I don't think anybody's shocked by that. Like folks on marijuana aren't really known as go-getters, right? I mean, that's the stereotype. And while I want to avoid stereotypes whenever possible, quite often there's some thing that started that. And so folks on marijuana, at least low doses, doesn't seem to really increase aggression. Moderate to high doses might actually increase aggression, though. And I know this seems a little paradoxical, but what is one of the negative side effects of marijuana use? Starts with a P and ends with an paranoia. Yeah, paranoia, right? So there you go. I just didn't want us to take too long on that. I didn't think people would guess. So if you've ever been around someone who's, taken maybe a higher dose of marijuana or maybe for some time, paranoia is often one of the side effects that they experience, one of the negative side effects that you're not going for. So you would imagine if you were a little paranoid, you might be a little extra aggressive, right? Because you might think like, on edge, you're kind of agitated, right? Your anxiety levels up a little bit, so it's not surprising that might actually be what's going on there. And I don't know if you've ever seen someone go through withdrawal. So withdrawing of anything is not going to be pleasant, right? Because that's why we call it withdrawal and not super bonus fun time. So when you've done something for a while and that was a pleasurable thing that you were doing and then you quit that's not going to be a good experience necessarily. Right now, depending on the drug, it can be worse than others. For marijuana withdrawal, it does seem that aggression increases. Of course, you're going to be a little irritable, right? And that's a standard withdrawal sort of phase. But that actually seems to dissipate after the first week. So 1 week into withdrawal, then it's kind of like, I'm no longer extra aggressive. You might be dealing with some other effects, but at that point, you're good to go. So that's exciting, right? So maybe we should give everybody low doses of marijuana. If we're going to give them Ritalin, give them a little marijuana while we're at it. We'll just give them ketamine. That really reduces your aggression. That'll knock you right down. No one's ever been on ketamine and aggressive at the same time. I promise you that.
I've heard coming out of it, they can be really
Yeah,
aggressive.
yeah. Now that's a different story. You just got to keep them on it all the time. Just don't let them come back up. Yeah, because it is. I mean, you can imagine it's a dissociative anesthetic. all of a sudden you're popping up out of nowhere. I mean, right? And you're like, whoa, why am I here? And you don't know, and that could be a weird experience, and I can imagine, you know, at sort of that psychological level, but then there are other things that might be snapping back into place too. That's why you always, like, if you anesthetize, how many of you have horses? Anybody have a horse, a cat? It's a vet. It's an animal that goes to the vet. That's what I'm going for you, right? So a cat or a dog, they'll use ketamine as an anesthetic for that as well. So that's why you got to watch them when they come out of their anesthetic too, right? The cattle. Right? Has anybody ever had that experience with a cat coming out of anesthesia that's a little like eat your face?
My dog was like that.
Huh?
My dog.
Your dog? Oh, I thought you said your toad. At first, I was like, wow. I mean, it's like. I mean, you could use. I mean, I don't know. My sister worked at a vet's office for a while, and she said it took 4 people to do this. Had to like immobilize a hamster so they could put a cast on its leg. I don't know. I thought that was funny. It was injured in a fight with another hamster. No, I don't know if that was true. But there you go. So yeah, so ketamine, I don't know. Don't use it is my suggestion. Not that you'll remember. What about tobacco? Does tobacco make people more aggressive? Only if they've been on it for a while and then you take it away from them. Right? So tobacco deprivation seems to increase aggression. So if you get a number of folks who use tobacco and then you prevent them from using tobacco, they get agitated, they get aggressive, and you stick them in one of these paradigms, they're just going to be shocking people left and right. So watch out for that. What about opiates? What's interesting is like codeine, for example. Like a moderate dose of codeine actually seems to increase aggression.
I thought that would make you lethargic too. That doesn't make sense.
Yeah, it's weird, isn't it?
Yeah.
It's sort of this paradoxical sort of situation with opiates. Most opiates don't tend to make you aggressive, but there have been a couple studies that, again, now we're not talking, we're talking moderate doses of codeine tend to make you a little more aggressive. And this could be, if it's not enough to really hit you with the sedative, but it's enough to sort of get the pain away, right? And then you might be a little more mobile. You could think, like, well, maybe I feel a little better. Or why am I, I don't know. It depends on, what's going on there.
Well, I'm thinking if it makes you sleepy and then they keep you up.
Yeah, that makes
it might
you
be like a sleep deprivation.
Yeah, I that particular study, I don't think that's something they considered. That would be interesting. Yeah, you should do that.
Yeah.
You guys come up with all these great ideas, but you have no motivation to do anything. Hey, why is that?
Maybe we're smoking weed.
I assume most of you do. Just as a general operating procedure, makes my life easier, and I'm less surprised by your behavior from time to time. My only recommendation is, like, don't get caught doing it until you've paid your bill, because then the university's collected your money, Kate. They'll pay my salary. Because if you go to jail, I don't think they let you go to college. Which is kind of stupid, right? I think, like, if you're in jail, you should have to go to college. Right? Like, that's what I would do. Like, nobody puts me in charge of these kinds of things. But I would be like forced instruction. Like, that's what I would do to people who are in prison. I would, like, make them learn. Seems really cruel, right? Yeah, I know, right? It's going to be helpful when they get out, right? It'll make their transition more easy. I don't know. This is my approach. I don't know. Then you gotta, like, what if you give, like, free college to people who are in prison? You ever think about that? Yeah, I don't know. I don't think anybody's gonna campaign on that, are they? Free college to all inmates. All right, what about benzodiazepines? How many of you know about benzodiazepines? Yeah, these are actually, they're actually prescribed when somebody's agitated and aggressive, right? In a very acute setting. So if there's ever, I don't know if any of you have ever worked in sort of like a psychiatric intake situation. Somebody comes in, they're a little aggressive, they're sort of agitated, difficult to control. They'll give them a benzodiazepine, which will sort of put them down quickly, right? Certain benzodiazepines will actually work within moments, right? Some of them are very rapid acting. The problem is that there are actually a few folks where benzodiazepines will increase aggression. Okay, not in everybody, but in a few, right? So sort of this, again, this paradoxical sort of, and I don't know that anybody's mapped this out genetically, but I'm assuming it's an enzyme issue. How many of you have ever taken NyQuil? That's a fairly low-level question, right? How many of you have ever read on the box? I mean, what should NyQuil do to you? It should make you go to sleep, right? How many of you have ever read on the box that, like in some folks, it actually causes hyperactivity? You ever see that on there, Chelsea? Yeah.
I am the person that
Yeah.
causes hyperactivity.
Yeah, I know. I got you. My wife takes Dayquil and like falls asleep as soon as she smells it, and then I'm like over here drinking a whole bottle of NyQuil, like trying to stay up later so I can do more work. Try a little bit of that. Yeah, it just doesn't, like for some people, it's this opposite effect. So, there you go. So what do you take when you try to go to sleep?
I just suffer.
Yeah, there's not-
Nothing helps me sleep.
Yeah. I don't know. I think some of that Alka-Seltzer nighttime. Sometimes that works. There's like this Alka-Seltzer, like severe cold and flu stuff. It tastes like dishwater, which is really nasty and it's bubbly, but I seem to sleep okay if I take that. All right. There is also some conflict, this is one of the examples, between that continuous, or that competitive reaction time task and the, take your money away task with benzodiazepines, right? Because the, point subtraction approach is more sensitive, we're actually going to be able to see that there, in most folks, is that reduction in aggression. Okay. What about stimulants? What are CNS stimulants? That's like amphetamine. Okay. Most of the time, those are going to increase aggression, right? They're going to increase your aggressive behavior. But again, there are some limits. There are some CNS stimulants or dosages once you get up so high that you don't like seeing the increase. All right, we got a little bit more to talk about. So this is sort of interesting. Tryptophan depletion, right? Do you guys know how they do tryptophan depletion? It's kind of interesting. They like give you an amino acid drink, right? Like a drink full of amino acids. And when you take this, it's actually going to cause you to deplete your stores of tryptophan, right? So your body's not, you don't need to make tryptophan anymore. You're not going to make this. And so you can sort of deplete the tryptophan that you have stored. We all know that you have to have serotonin in order to be relaxed, right? So keep that in mind. That'll probably be on the exam somewhere. Probably 4 to 15 times. Also, we've already talked about reuptake inhibitors with serotonin. So when you give individuals SSRIs, for example, we're going to increase serotonin, it's going to decrease aggression. That's not a real surprising idea, is it? What about lithium? Anybody know anything about lithium? Yeah.
Give that to people with bipolar.
All the time. And that's like the best, that's the most effective drug to give someone who is bipolar, is to give them lithium, right? I got a software update yesterday, and since then it's been killing my battery. Did you get a software update? Yeah, I've got an Android though. So I don't
Last
know.
couple updates have been killing people's batteries.
I'm gonna go
across the
like
board.
kick Samsung in the face. Can I do that? It's really been bothering me. Like so much so like I can't even get it charged all the way up. It was like 40% when I came in here. It's like 15% now. Lithium's kind of interesting. It's a non-sedative reduction of aggression. Now, Brooke, we talked about like anytime we give you a sedative, it's going to reduce your aggression, right? But lithium not being a sedative still reduces aggression. The crazy thing about lithium is it sort of just works on every neurotransmitter system we know. And so it's kind of hard to pull out specific effects of lithium. And if you ask someone like, hey, how does lithium help people with bipolar? They'll go, it does. That's it? That's what we know? We know it does. We're not really sure how. And again, it's because of this like broad action.
How'd they figure that out?
They did. So quite often how this works is, I'm not really sure with lithium in particular, how they figured out that lithium works, but they will develop these drugs or have drugs that work for one thing, and then they'll notice like, wow, that helped these folks with this other issue to comorbidity, right? So in that case, comorbidity is an advantage. Because if you have, if you're giving someone medication for depression, but you also notice it helps with irritability, then you can say, well, maybe we can give this to folks who are just irritable, right? So, but with lithium, I really don't know the history of that, how they determined that it was the thing to give people who are bipolar. But there you go. Something to look into. I'm sure there's a Netflix documentary on that. I really don't know if there is, but there you go. Antipsychotics, right, will also reduce aggression. These are drugs that you typically give folks with schizophrenia. Okay, so they're going to be dopamine antagonists. The problem, and the reason I put short term, is the problem with taking antipsychotics for an extended period of time is you run the risk of developing a movement disorder called tardive dyskinesia, which is, it's basically like drug-induced Parkinson's disease. Which you want to avoid, Meredith, just in case there was any debate about that. And then also, beta-adrenergics will reduce aggression. So, things that are going to block, beta blocker things. Again, not surprising. I mean, if we're talking about adrenaline, you start reducing that kind of thing, you're going to reduce aggression. All right, who's got questions?
Are there any common foods or drinks in the American diet that deplete tryptophan?
That's a good question, actually. I mean, people always talk about turkey having a, fair amount of tryptophan, but I don't know that it's enough. I mean, it's concentration.
I've heard it's real negligible.
I mean, so I don't think, these beverages that they make are pretty, they're pretty high. They got to have a high concentration to really actually, kick in this tryptophan depletion process. I don't know, that's a good question, right? Because then you're starting to think like, what if there's like a group of people who eat a particular food?
That's what I was wondering.
Right, yeah, I'm thinking, I don't know. That's something to look into. I know you're gonna ask about potatoes, right? I mean, just like going back to this whole, like Irish concept, right? That's, I suppose, a fair question. I don't think potatoes, they're just starch, so I don't think that's going to do anything for you. Yeah, you have to eat something with a pretty high concentration of tryptophan to make this happen. But you could do it potentially. You could potentially design your diet that's going to be high in tryptophan. Kind of like a fun thing to do, right? It'd be a fun experiment. Or, better yet, how many of you live with someone? You don't have to answer that. I don't really care. But if you do, and you're like responsible for their food, I think you're like, right? See, now you're thinking like, I'm gonna like sprinkle some like amino acid powder in there, right? Like get some tryptophan powder and start putting it in their oatmeal or something. I mean, I know you guys eat oatmeal. No, you don't eat oatmeal? Really? That's surprising. I eat oatmeal all the time. Right? Abigail, it's a great. Do you steel cut or you do rolled? Oats. You eat oatmeal. You
I just what's in the. I just got buy whatever's in the grocery store.
Oh,
Just
okay.
oatmeal.
Just oatmeal.
Yeah.
Not an oatmeal connoisseur. You get the kind with the little dinosaur eggs that hatch the dinosaurs. I used to eat those when I was a kid. I don't know. Steel cut's usually what I eat.
That's the best way to go.
Yeah, steel cut. I mean, you gotta, and just mix in there whatever, some local honey, some dried cranberries sometimes is good. Hershey's chocolate bar. No. All right, no more questions. That's great. Here's what I'd like to do. I'd like to sit here for